And if you're not muted, go ahead and mute yourself. All right, I'm just gonna wait a minute to see if any more folks come in. And just so you know, we are recording this meeting and it will be sent out after the presentation. So all right, looks like we don't have anyone else coming in right now. So if my Grace and Miriam, you'll look for people to admit. I'm going to go ahead and get started with the meeting today. All right, so good morning and welcome to the Coordinated Human Service Mobility Plan FY25 Regional Coordination Meeting for the Alleghany region. I'm Jess Maffey, a Transit Programs Manager at the Virginia Department of Rail and Public Transportation. Just before we get into the meeting today, I want to do a little housekeeping. Please be sure to keep yourselves on mute. We've made it so that you can unmute yourselves later on because we'll have an interactive portion. But for the presentation itself, just go ahead and keep yourself on mute for me. There will be an opportunity to ask questions. We'll pause then, and you can use the raise hand feature up at the top, or put your questions in the chat, and we'll get to them at that point. Like I mentioned, there's also going to be a brief discussion at the end, and I will be calling on each of you to unmute and introduce yourselves. And I see some already have their cameras on, but at that point, I'll also invite you to turn your cameras on if you would like. This webinar and each regional webinar is being recorded, and we will post the recordings on our YouTube page and send it out to all of you. You will also receive the slides from today's presentation, and there are several links embedded in the presentation that I'll indicate as we go through. So that will all be available to you, all the materials in there. And finally, for the human services agencies on the call, if you're planning on applying for the FY25 5310 application, this meeting does count toward points on that application. I have a list of registrants. If for some reason you're coming in as a guest or you somehow didn't register, just shoot me an email and let me know so I can make sure I have that for your application. All right, getting into the meeting agenda for today. The first thing we're going to do is a quick group introduction in the chat. I'll get to that in a second. But then after that, we're going to go into, what is a coordinated human services mobility plan? And this is it's probably a refresher for several people, but I know there's been turnover or new people in their roles. So I wanted to go ahead and just go over what it is at a high level, what the federal requirements are for us, what the format is this year. And then I'm going to go over the 2022 CHSM plan, which is really an update from the 2019 plan, some of the new features of this update, and then how to use the plan. And then we're actually going to go into an online version of the CHSM plan. It's called a story map. Some of you might be familiar with this, some of you might not. That's fine. We're going to explain the whole thing. And my coworker Grace is here, and she'll be going through that portion with us, and we'll get into the action trackers there as well, which is kind of the relevant portion for your application. And then we'll go ahead and do a brief roundtable of introductions. If you're planning on applying for the 5310 funding, this will be where you'll want to mention what you're applying for. So we'll get to that at the very end. To get us started off, if you would please, if you're here in the meeting, in the chat, in one message, please share your name, title, organization you're with, where you're located, and your email address. If you don't wish to share your contact information, that's fine. Basically, we're just using this list so that I can call on you at the end of a meeting and to share with the group afterwards in case you want to connect with each other. So let's just take a minute and have you all drop that into the chat. The chat is at the top of your screen. And I'll just give you a second to put all that in there for us. Right. Seeing some familiar names. All right, looks like we got a good amount of people. So I'll let you all finish up putting those in the chat, and I'm going to get started on just an overview of what is a coordinated human services plan. So the Coordinated Human Services Plan, or CHSM as we call it, is a federal requirement as part of the FTA Section 5310 program, and DRPT is the lead agency for developing this plan for most of Virginia. So according to the FTA Section 5310 requirement, the CHSM plan is one that assesses current services in the state and transportation needs of seniors, people defined as 65 years old or older, and people with disabilities. It also identifies strategies to address service gaps and sets priorities for project implementation. It's really high level statewide strategies when you're talking about a state, particularly as big as ours. The strategies are pretty high level, but we break it down into sort of regional action items that relate to these strategies, and that's where you all come in. So a little bit more about just how the CHSM plan's organized. The urbanized areas of Northern Virginia around DC are included in a plan developed and maintained by the Metropolitan Washington Council of Governments. So MWCOG receives funding to support localities in Northern Virginia. So any locality that COG receives funding for is not eligible for funding through DRPT. There's a few specific localities that cross regions, but for you all, that's not really relevant because you're a little outside of that. But just so you know that the DRPT plan does not cover Northern Virginia outside of DC. And can you all see this that I've been changing slides? I just want to double check. No? Okay. Nope. All right. Dang. All right. Can you see the introduce yourselves in the chat slide now? No?
No.
Okay. This was an issue in my other presentation. I don't know why. Melissa can see them. Okay. Well, if you're able to change slides on your screen, I'm on slide 5. If anyone who can't see that the slides have changed, okay. All right, thank you. Okay, I'll just indicate when we're changing slides so you can follow along, and I'm sorry about that. All right, next slide, slide 6. The FDA, according to federal regulations, the CHSM plan has to include input from the people it covers, which includes individuals with disabilities and seniors. It also has to include representatives from public, private, and nonprofit transportation agencies, human service providers, and other members of the public. There's a strong focus at the federal level on coordination and collaboration. That's part of the reason this plan exists. This plan is meant to bring together all the stakeholders in an area to ensure that individuals who need transportation are getting it and that services are not being duplicated within an area. This plan follows a federally mandated update schedule. with a minor update every 3 years and a major update every 6 years. We just completed the minor update, so the 2022 update, which provided updated demographic data, inclusion of new survey results, and some updates to the action tracker strategies based on those results. The next update will be in 2025, and that will be more of a overhaul with a lot more involvement, like in the 2019 plan. Next slide. So the Coordinated Human Services Plan format, it is one document that covers, again, the entire state besides Northern Virginia. It includes a summary of statewide demographics, available transportation, needs and gaps in services, and then strategies to address those needs. It also contains regional elements that address the unique challenges, needs, and goals of a single region. So I'll talk a little bit more about the formation of the 2019 plan later, but basically we've divided the state into 6 regions. We're in the Alleghany region right now. And the purpose of that is really for the plan to both demonstrate statewide challenges as well as the more regional specific challenges and how those relate to each other. The 2022 update also includes a story map version, which I mentioned. The image on the right here actually links to the PDF version of the plan. So again, when you get these slides, you'll be able to just click on that and go straight to the PDF. It's currently available on the DRPT website. We've always put out the plan as a PDF and we'll continue to do so, but this year we also built an online story map version of the plan. If you're not familiar with a story map, it is a function through ArcGIS that allows you to present a narrative document while also embedding data into maps that give you a lot more in-depth detail on any type of data that can be map-based, basically. So we're excited about the story map and to share that with you all in this meeting, and we'll demo that shortly. And I'm going to slide 8. So getting into the 2022 update a little further, really to get into 2022, you have to start with 2019. A lot of you may have been here for that. Some of you may not have been. But since this was just an update to the plan, not an overhaul, the basis of the 2022 plan is still very much the same as it was in 2019. So just to recap how we created the 2019 plan, one change was that we identified 6 regions of the state that follow the Department of Medical Assistance Services, or DMAS's regions for Medicaid providers. And you can see here at the top, I just included the DMAS map with their Medicaid regions indicated. And then at the bottom there is the CHSM region map. So we're in the Alleghany region, and you can see it just follows along with the DMAS map, which was meant to be something that was at least familiar to many people. We also, as part of the plan creation, conducted a study involving multiple surveys, interviews, ride-alongs, and public meetings that identified those statewide needs and gaps in services. The plan identified underserved populations beyond 5310 and spoke about those, including low-income, veterans, and homeless and youth. It also identified gaps specific to each region and recommended strategies through an action tracker. And it also identified major statewide recommendations for coordination across all groups, including for DRPT. So the basis of the 2019 or the 2022 is still very much the same as the 2019 plan. Going into the next slide, slide 9. We used in the 2022 plan, we've used the same regions, same populations and providers, but we've provided updated demographic data based on most recent census data. It also included and analyzed rider and provider surveys. Those were conducted online. Again, not as in-depth as kind of the public meetings and interviews and everything, but we had 2 online surveys. The provider survey was analyzed by a VCU master's group, and then the rider survey stayed online for several months, and we analyzed that and included all that information and findings in this plan. Based on those findings, we did end up adding a new category to the action tracker based on those results, and I will get into that when we go through the action tracker. And then as I mentioned, we also added a public-facing story map version of the plan to DRPT's GIS library. So this, again, like I mentioned, there's a lot of links embedded here, but this is basically the landing page of the story map. And if you click on this image, when you get the slides, you'll go straight to that story map. The story map is an exact replica of the PDF copy. It has all the same information included, all the narrative information, but includes those interactive maps with data that you can dig into further than you can get into in a static PDF. So we're hoping this is going to be a helpful resource for you all, even beyond this application. So yeah, let's go on to the next slide, slide 10. I'm going to pause on this slide for a little while and just kind of get into both how DRPT uses the plan, as well as how we recommend that you all use the plan. So DRPT will use the CHSM plan to guide our investments in the Virginia's transportation services that are designed to meet the needs of seniors, individuals with disabilities, and other priority populations. Anyone who's applied for 5310 knows that the eligible population is seniors and people with disabilities, and that's what this plan focuses on. This plan is meant to be a living document that can be updated on an ongoing basis to account for changes in technology, new transportation challenges, and transportation successes. We expect our grantees to take an active role in implementing projects that advance mobility for all Virginians, and will continue to support these projects to the best of our ability. This plan, however, does not prescribe funding, nor will there always be sufficient funding through our programs to fund every recommendation. Organizations working to further transportation should continue to explore funding opportunities with other local, state, and federal agencies. And that's kind of part of what this plan recommends or provides some suggestions for is that coordination around funding as well as other projects. So how you all should use the plan. The plan provides a lot of high-level information, but the idea is that when you're reviewing it, going through your region or just through the plan in general, there might be some challenges or opportunities that stick out to you based on what you know about your region, your partners, or even potential partners. The first bullet there says the plan identifies statewide and cross-regional challenges. So this plan at a basic level demonstrates that a problem in one area is likely a problem in another area. There just might be different types of obstacles in each region. So to just give a few examples of statewide challenges the plan identifies, which I'm sure a lot of human services agencies are already familiar with, but for example, there are long driving distances in rural areas. Whether you're in Southampton Roads or Big Stone Gap, you're not going to avoid these long distances. Just in Hampton Roads, you might have tidal flooding as opposed to mountains and heavy snow and Big Stone Gap, but it's a similar issue. Another example is that public transportation doesn't always cross locality lines. And there's examples of, folks getting to an end of the line, having to get off and walk to wherever they're trying to go, just because that transportation ends at a certain point. But there has been examples in the state of cross-agency collaboration to kind of address those needs. So one, which was not a 5310 project, was between WADA and Hampton Roads Transit. They were actually able to form a cooperation and use a federal grant to connect two bus lines to a clinic that was outside of one of their stops that they didn't quite get to. So again, it's that sort of collaboration that, when you're looking around and identifying issues, is there another group that you can reach out to who maybe could help connect those dots? And as we all know, the cost of transportation is prohibitive for some individuals, particularly for those who need more than one trip every now and then. So, a low-income individual who doesn't own a car but needs to get to work, or someone who needs dialysis 3 times a week and lives in a rural area. These can just be challenging rides to fill, and I know folks are always trying to address those challenges. The plan also provides ideas for how agencies can seek out different sources of funding or collaborate with other groups to provide service. So a few examples of that is, one is exploring additional federal opportunities for funding. This could be FTA programs that DRPT or even a different provider or a planning district commission applies for, or it could be funding for transportation provided through another agency that can be coordinated with FTA funding. So there's sort of, looking at opportunities to layer federal funding or look to other partners to even apply for funding that you can then benefit from. Uh, the the example here of opportunities for agencies to seek out different sources of funding and or collaborate to provide service. It could mean a lot of different things to different agencies. One example is that, CSB's community service boards receive general funds through the Department of Behavioral Health and Developmental Services and may use some of those funds for transportation. And there could be opportunities for DRPT to work with other statewide agencies or programs to consolidate funding for transportation. That's something that, it's not just not a recommendation for you, it's a recommendation for us as well to look at, cross state agency collaboration. And it's always something that you could bring to our attention if you see opportunities there. In terms of TNC's, transportation network companies, I think we're all familiar with Uber or Lyft, and I think now people in transit are also very familiar with other companies out there that follow a similar model, but have kind of a different product. So the example there is in Richmond, the public transportation provider GRTC is using UZURV, UZURV, which is a TNZ to augment its paratransit service. So they're able to contract with them to provide a good, reliable service that's been pretty successful. And DRPT is always interested in learning more about, if agencies are looking for innovative or new ways to see how they can use different solutions that could work for them. But again, it's really what works for your region, your area, what's available to you. So the next thing on this list is, really kind of getting more into a practical use of this plan for if you're applying for 5310 funding. So this plan helps to identify the types of projects DRPT would consider a priority. It's really to, it's not prescribing what we fund, as in projects that don't perfectly align with the goals in the plan or the exact strategies or action items we're suggesting. It's not like those are going to be ineligible or automatically rejected, but it does just help you to get a more in-depth picture of what DRPT has identified as important or a priority in each region. Plus, when you do apply, you are required to fill out a couple of questions about the plan, including what action tracker goals your project ties to. So we do expect that you're reviewing the plan and thinking about how it ties into your project at the very least. And finally, a part of the plan is these meetings, just once a year, bringing together groups in your region to meet each other and hopefully put some faces to names. And if you're looking for a potential partnership, to give you that contact information, names. I know a lot of people know each other, but again, there's always turnover. New people come in, old people go out. So I know I'm new. So it's always nice to kind of get that face to the name and see who's out there in your region. All right, so with that, I'm actually going to turn it over onto slide 11. We're going to go over to Grace. She's going to take over and share more about the story map.
Okay, I'm going to share my screen. Hi, everyone. I'm Grace Stankus. I'm a transit planner at DRPT, and I provided some assistance with the CHSM plan update, and I'm going to do just like a quick demo of the functionality of the story map. So I know Jess sent a link to everybody, and once these slides are available, you'll be able to click through the story map there. But just another way to access it is to go on to DRPT's website, drpt.virginia.gov, go over to our grant programs, down to Human Services Grant Program. And then this has, all the information you need for your applications. But if you scroll down to the bottom for application resources, you will see the PDF version of the plan, the second link, and then the third link is the plan, the link for the story map version. So I'm going to click there. So it'll bring you to this homepage, which Jess mentioned looks the same and has the same content as the PDF version. Everything is in the same order. I'm just going to click around a little to show a bit about the functionality of this. Also, the plan looks a little better when it's viewed on like a widescreen monitor. Sometimes things can get a little like condensed on a laptop. So if you have the option to view it on like a wider screen, that is probably recommended. And so we have a statewide profile that again has the same information as the PDF version of the plan, but it also has a little bit more interaction with the data. And so it takes a little bit to load. There's a lot going on here. But we have the senior population for the state of Virginia. And here you're able to click around and view the data at a county level. Let me give it a minute here. And just get like some quick stats for each county for the senior population. And all of this is scaled. So if you zoom in on the map, again, it's taking a little bit. You can also like see the data for a census tract level. And so this is just like an interesting way to kind of view the data that you're not able to see on a PDF version of the plan. So here you go. Here's like the quick stats for just a census tract level. And as you zoom out, again, you can see it by the county level. And so here we just have the senior populations going into the population with a disability. And this is, of course, at the state level comparison. The same thing with the scaled map options. And then we also added in some other characteristics that aren't necessarily 5310 specific, but they impact mobility. And so these, you can view the map by clicking on these buttons to turn these certain demographics on and off. Again, the same thing as you zoom in, you can see it at the census tract level, and zoom out, you can view it at the county level. And so here we have population and poverty. Again, all of this is in the PDF plan. This is just like a different way to view the data. And so this has a little bit more information in it. Just a neat sort of way to view it. And then we also have zero-car households here for the state. Vulnerable Populations Index, which is an index that was developed for a previous DRPT study. We have the definition here. It just kind of combines a bunch of different demographics to come up with an index of vulnerable populations. And then again, just final demographics that can be viewed at the state level. And once you're done in any of these chapters and you would like to move on to another chapter, you can either select that up here, or you can go back to the home page using this kind of square button at the top. I'm going to quickly go to the action tracker just to show you how that works. Again, it's all the same information as what's in the PDF plan. This is just a different way to view the information. And so we have the definitions of each of the identified gaps here. And again, you can click through all of them, but you can click on the action tracker and that will bring you to this interactive table that lists all of the gaps here, the goals and the action items to kind of bridge the gaps. And what's different about this than the PDF version is you can kind of filter, and if you just want to look at the accessibility gaps, you can click that and it'll just bring you to the action items for that particular gap. Or if you'd like to select by goal, say improve rider experience, you're able to select that way and just see the 3 actions that are associated with that particular goal. And so again, this is just sort of like a different way to interact with these as you're working through your application. And then finally, the last thing I sort of wanted to show you all is the regional profile section. And so we've created, wait for it to load. Okay. We've created individual regional profiles, again, sort of like the 2019 plan. And so these they kind of look like the statewide profile, but they're specifically for the region, and they go into the regional issues and demographics for each. And so on the Alleghany region, it's just showing data for this particular region. So we have, just a little summary about the region. You're able to view transit service, just particularly in this region. And so I think this is helpful for seeing what service is currently available in each region in terms of like coordinating and um, collaborating with regional providers that are already existing. So this is a neat feature here to click on and off that you just can't get in the PDF version. And then again, similarly to the statewide profile, we just have the senior population for just the Alleghany region here. Same sort of thing with the pop-ups. You're able to click on and off and see it at a county level and the census tract level. Population with a disability. And then we included these demographics that were also on the statewide profile, but we didn't have a write-up for each region, but these are just available to see the data in a different way. And then the regional profiles also include the regional issues, which has the table this is in the PDF version, and it shows the things that came up, the regional issues that came up in the outreach in 2019, and anything new in the 2022 surveys, or if the issues sort of have remained the same, and the gap that they're associated with. And so this is here for each region. And then finally, there are high priority action items that sort of emerged from the outreach, and Jess will talk a little bit more about these when she goes into the action tracker. But these are just sort of things that came up, repeatedly as priorities to address for each region. And so these are the associated action item that maybe you'll reference in your applications. And then here again, you can just view the action tracker directly through the regional profile. And again, like hopefully this will help as you're working through your applications, but I think ultimately we would love for this to be a resource as you work through not only our application, but just other sort of applications and projects that you're working on. Like hopefully this can be a valuable resource. And so that was a lot of information. If anybody has any questions.
Yeah, we just wanted to pause for a moment in case I'm going to go into the content a little more, but does anyone have any questions about how to navigate this format or how to find this? All right, I'm going to go ahead and take over sharing my screen. All right. Can you see my screen okay? Yes. All right, good. Okay, just kind of jumping off of where Grace left off, I wanted to go ahead through the statewide action tracker to give you a fuller picture of the gaps and goals. As you saw in the regional action tracker, that's where you can go to find your priority action items for the region. But ultimately, your project should align with any of the goals or action items identified in the action tracker, not necessarily just the ones identified in your region. So again, it's priority versus just sort of generally, what does my project really align with? What are they looking for here? I'm going to read through each one of these individually, which should hopefully give you an idea of how we're thinking about and defining these gaps. However, you can go back through and read this chapter for a more in-depth explanation and sort of how we came up with these gaps. I also wanted to mention that for the application, if you're applying for the 5310 application, it's not important how many of these you're tying into. It's really just that you're looking for how your project aligns with any of these items. So I'm going to go ahead and go through this. The first gap here is trip availability. The goal being to expand service availability, and the action items are identified as expanding after hours transportation, increasing the availability of long distance trips, and expanding trip types to better meet rider needs. Under the gap of trip accessibility, it's kind of the basic one, but improving access to human service transportation. So providing transportation to people who cannot use it or live in an area where it's not provided. It could be enhancing scheduling to just make it easier for people to find you or schedule with you. It could also be exploring the feasibility for expanded door-to-door service. So, increasing access that way for more people who need that extra care. I want to pause here on this gap, trip reliability, because this is the new gap that I mentioned earlier that kind of came up because of particularly the rider surveys. So we got a few hundred responses in the rider survey, and we're noticing that there was a lot of language around the idea of reliability of service. So when we were analyzing the survey results, particularly in the narrative portions where people were writing about their experiences, that they were using words like reliability as well as like cleanliness, friendliness, or talking about their experiences using technology to schedule, whether it was really easy or really hard. So that idea of rider experience really does seem to overlap with other categories, but it also kind of has its own nuance and depth of what the experience is. So we wanted to include that in this year's plan. Again, some of these action items might be the exact same as others, but the idea is if you're indicating this on your application, there's something about the rider experience you're trying to address. So again, this action item would be implementing standardized education and training opportunities for all operators to ensure they're kind of getting a consistency of service or aid to who they're driving. It could be increasing staffing so that operators can better meet passenger scheduling needs. It could be exploring implementing improved public-facing technology, such as software or apps that is made to be user-friendly. Or maybe your riders, don't want to use technology, and there's some other way that there's a user-friendly way for you to meet their needs. This is just, again, these aren't prescriptive. This is just meant to align with the type of project that you're doing. Under the gap of service alternatives, this is meant to be expanding transportation options. So this could be partnering with public transportation providers. It could be partnering with hospitals, medical centers, or other healthcare facilities to determine how, maybe your services can align with what their clients need. It could be partnering with educational facilities for their disabled students, or if they have older adult students. Or it could be continuing discussions with, TNCs again, to figure out what their role is or if they have one in your services. Another gap identified is coordination, and this kind of applies on more of a statewide and regional level for, you all as well as us. So, one could be working with your local jurisdictions to include human services transportation into local transportation planning, kind of advocacy for human services. Another one that was developed for DRPT was maintaining statewide and regional advisory committees to focus on coordination. That's something that in the 2019 plan was recommended and we started doing and sort of fell off during COVID. So that's something that we're thinking about how or what the outcomes or goals of that sort of group would be. Could also be continuing communications with organizations that are involved with and support transportation. So, many of you know CTAV, VAM is another one. There's lots of different groups like that that you can connect with. Education and training has the most gaps and kind of a variety of goals here. So, this increasing awareness of available service is meant to be these sort of outward facing goals. So, reaching out to the public, or if you have a set client base, making sure that they know transportation is available, or if people are coming into your program, making sure they know that that's a service that's offered. So kind of the idea of marketing promotion. And then we've got the sort of inward goal of education and training. So providing expanded training opportunities for operators, making sure, they can provide that additional aid to their passengers if that's something you're offering. Setting standards for training, or using a nationally recognized training course. It also could be providing introductory travel training for new riders. That could be a different service that you're interested in. And finally, increasing safety and preparedness is under education training. This is really, after the pandemic, making sure that you have a plan and it's established somewhere now that we've all sort of gone through it once, hopefully only once. Under funding gap, this is something, we all want to do and kind of feeds into all these other action items, is increasing sustainable funding streams. So some of the things here are, increasing funding for labor costs to recruit and retain operators and staff, obviously a consistent issue throughout the state. Exploring and applying for alternative funding sources beyond 5310. If there's community grants you can apply for, or if DRPT is putting out other special projects that you can look into. And of course, it's continuing to work with local and regional government officials to increase or add funding for human services transportation. Again, I think of it as kind of like an advocacy of human services transportation in your area. None of these are easy, but the idea is that if that's something you're working toward in your organization, you should include it in your application as one of your action goals. Okay, with all that being said, I'm going to stop sharing and go back to my presentation. So just give me one moment. Okay, does anyone at this point have any questions before we just get into our roundtable of introductions? And can everyone see the slide that says questions? All right, if no one has any questions, I can circle back at the very end if anyone has anything else come up, but I want to go ahead and if you would like to turn your camera on, feel free to do so, because I am going to be calling on each of you to speak. So I'm going to call on each group, and I'm going to start with the groups I know first that would be applying for 5310 or potentially applying. And I'll ask you to briefly introduce your agency, what type of funding you're planning on applying for, and just talk about your project very briefly. And then anyone else I'll circle back to at the end. And if you're not applying, you can let us know. But at least, introduce yourself and just let us know who you're working with. So I'm going to bring up my list. All right. Looks like first up, we've got Edwards Adult Day Center, Patsy Dillard. If you'd like to come off mute and introduce yourself. All right, I might circle back to you. Next up, we've got Central Virginia Alliance for Community Living, Ken Young. If you'd like to come on, introduce yourself.
Yes, can you hear me okay?
Yes.
Okay, great. I'm Ken Young with the Central Virginia Alliance for Community Living in Lynchburg, Virginia, and our planning district, unfortunately, overlaps two different regions. At this point, we're going to be applying for some replacement vehicles to replace some of our dilapidated ones that really are no longer good for service, probably a minivan and a raised roof van. Which we're still waiting on some of those to be delivered, but also for some operating assistance through 5310, which we still refer to it as the New Freedom Program, but it's part of 5310 now.
Great, thank you, Ken. All right, next up, we've got New River Valley Senior Services. I see there's a few different folks here, but if someone from New River Valley wants to introduce you all.
Hi, my name is Monica Music. I'm with New River Valley Senior Services, and I'm the Director of Programs. Leon Dalton is with us. He's with the mobility program of that now. And Jennifer Byers, our physical finance person, is with us today also. So with our programs, we cover the whole New River Valley, serving those people that are 60 and older and or have physical disabilities. And we will be requesting a couple replacement vehicles, probably the 9 passengers. And then Leon will also be requesting some funding for his mobility program.
Okay, great. Thank you, Monica.
Thank you.
Yeah, no worries. New River Valley Community Services, Trevor.
Yep, I'm Trevor Zachary with New River Valley Community Services. We also service the New River Valley as the Community Service Board. We will be looking at some replacement vehicles and also some operating to continue hopefully what we start this coming year on some on-demand for elderly and disabled in the NRV.
Great, thank you, Trevor. Henry County Senior Services, Ashley.
Hi, my name is Ashley Mundy. I am the Senior Service Coordinator for Henry County Senior Services. We are applying for a replacement vehicle, roughly about a 9-person passenger van. We service all of Henry County of individuals 65 and older, Monday through Friday. So we are just looking to do replacements.
All right. Thanks, Ashley. Next up, we've got Southern Area Agency on Aging, Kathy. Okay, Kathy, I'll circle back to you. Next up, we've got In Circle, Melissa Lisi.
Thanks, Jess. Good morning, everyone. In Circle is a health and human services nonprofit that supports adults with disabilities across the state. In this region, we'll be looking to do a capital grant to add a van to one of our group homes in the Bedford area, and looking also to do some different things in other areas across the state. We appreciate this program. Thanks.
Thank you. Let's see. Next up, we've got Roanoke County, Megan, here with us.
Good morning. I'm Megan Cronice, the Assistant Director of Planning for Roanoke County. We are very appreciative of FTA Section 5310 funding from DRPT for the last few years for operating expenses for our Core-Train program, which provides curb-to-curb service for seniors 65 and older and those with disabilities. We've been running since 1985, and we're looking for additional operating costs or funding to offset our county costs for the program.
Great, thanks, Megan. Okay, now I'm going to switch over. Well, I'm going to circle back. Is there anyone here from Edwards Adult Day Center? Patsy, if you'd like to introduce yourself.
I'm not sure she's on the call any longer.
Okay, okay.
Yeah.
Thank you. Sorry, I'm not looking at the actual participants, just the list. Let's see. I wanted to do, the local office on aging, Amy.
Hello. We have recently started or reinvented, kind of, so to speak, our transportation program, where we have purchased 2 passenger vans and hired our own drivers to do transportation for seniors 60 and older to doctor's appointments and to the grocery store and to the pharmacy. We have applied for 5310 funding before, but we're not able to get the funding. So, I was kind of investigating if we should apply again, kind of looking at the options and kind of weighing our options with that to see what our eligibility would be now that we have changed the processes with our program.
Okay. Gotcha. Thanks, Amy. Appreciate you coming in. Let's see. I'm gonna go to Ride Source, Lisa Sink, if you're here.
Hi, I'm a little different. So I'm a vendor with transportation, and we
Okay.
do rural transportation with the town of Bedford, and we also partner with Roanoke County on some of their transportation projects. So I'm
Okay.
just getting information as a vendor to potentially, work with you all as you provide services and fill gaps.
Great. Thanks for coming in. All right, next up I've got yeah, okay, I'm gonna circle back to Southern Area Agency on Aging, Kathy. Let's see if we can get you unmuted. Hold on just a second. Not sure what's going on there. We can't hear you, unfortunately. Kathy, if you'd like, and I'm sorry that your sound's not working, but if you'd like to drop your just your intro in the chat, I'll read it out, and I'll just continue on for now, but I'll circle back and read it out for you. That's all right. All right, moving on, we're gonna go to, there we go, Central Virginia PDC, Ada.
Hi, I'm Ada with the Central Virginia PDC based out of Lynchburg, and I am the CAP program manager. So just trying to get some more information, but we're not applying for anything.
Okay, great. Thanks for coming in. And we've also got the West Piedmont Planning District Commission, Joe. Would you like to introduce yourself?
Good morning, everyone. I'm Joe Bonanno with the West Piedmont Planning District Commission. Like Ada, I'm with coordinate the Ride Solutions Commuter Assistance Program, and I'm also here for just informational purposes, not applying for anything.
Okay, well, great. Thanks for coming. Appreciate it.
You're welcome.
Yeah. Okay, is there anyone else I missed who's on the call who would like to introduce themselves? You want to raise your hand potentially, or just unmute? All right. Oh, here we go. Okay, I've got Kathy's intro for Southern Area Agency on Aging. So it's Kathy Trout. She says, Southern Area Agency on Aging, one of Virginia's 25 area agencies on aging, nonprofit that provides services, resources, and information to individuals 60 years of age or older, people with disabilities, and their caregivers. Our service area includes the counties of Franklin, Henry, Patrick, and Pittsylvania, and the cities of Danville and Martinsville. We offer services established by the Older Americans Act, such as senior transportation, and through our subcontractors, Pittsylvania County Community Action, STEP, Henry County Senior Services, Franklin County Aging Services, Martinsville Senior Services, and it includes a 5311 recipient, Danville Transit. In addition, our mobility management program provides transportation services, including a voucher program, miles for events program, and a volunteer driver program. Our services are especially crucial in rural areas compared to the suburbs and urban areas, as we have a large percent of older adults. More live in poverty and are isolated, and more have chronic diseases, poor health, and have less to no access to healthcare and transportation. In addition to working with our 6 subcontractors, our mobility manager is involved with CTAV, VAM, the Virginia Association of Mobility Managers, the West Piedmont Planning District, and includes partnerships with Radar, which provides public transit for Martinsville, Henry County, and as well as with Ride Solutions, a ride share program. And finally, a number of private transportation providers, including Cheris, Arc of the Lamb, AKM, and Bolt Transportation. Our FY25 FTA Section 5310 application includes mobility management plans to apply for operating amounts similar to FY24, but will not include a capital application for a vehicle. Oh, and it looks like Patsy is with Kathy for Edward Adult Center, and she is requesting 2 replacement vehicles and will email the details to you. And that sounds great. No worries. I read your full description. It's all good. Do a lot of great stuff, Kathy. So I appreciate you coming in. And I'm sorry that we couldn't hear you today. All right, I'm going on to the last slide. If you all are following along, I wanted to share some just next steps and contact information for, particularly again, for anyone applying to 5310. We have a new online application that we're using this year, a new online grants management system called Web Grants, and we will be doing the 5310 application through that new system. So that is going to be no more Olga for applications, only Web Grants. So that means everyone has to register, and we're going to be holding 2 registration trainings on October 30th and 31st. Then I will be hosting a pre-application workshop on November 1st, which will also be recorded if you can't make that and sent out. And then the FY25 5310 application will open December 1st and close February 1st. Again, that will be all conducted through Web Grants, and there will be more trainings on how to put in your application. And we're doing this on an agency-wide scale, so you'll be getting plenty of emails about that. If you wanted to connect with each other, if you saw or heard someone on this call that you were interested in talking more to, one of the reasons I asked you to put all that information in the chat was so that we can send that out to the whole group, just so you have people's names and emails and where they're at. And of course, if you have any questions or would like to talk to me, or some folks have projects ideas that they'd like to talk to me about, you're welcome to email me or set up a time to call. I'm always happy to talk or answer any questions. So with that, I'm going to end the meeting. Everyone's welcome to head out unless you have anyone has any questions they'd like to go over. But I'm going to go ahead and end the recording and just say thanks for coming.